1. A CNA instructor designing a training program for oncology aides wants to align with adult learning theory. What approach best supports this goal? A. Repetition of information through rote memorization. B. Offering flexible scheduling and problem-based learning scenarios. C. Focusing on abstract concepts over real-world applications. D. Providing long lectures without discussion. 2. During clinical instruction, a student CNA demonstrates unsafe handling of a chemotherapy spill. What should the instructor do first? A. Report the student to the program director. B. Remove the student from the site immediately. C. Intervene immediately and review the proper protocol on site. D. Ignore it if no harm occurred. 3. When evaluating a CNA student's performance during a catheter care demonstration on an oncology patient, which method provides the most objective data? A. Written quiz results. B. Peer feedback. C. Performance checklist with defined criteria. D. Verbal self-assessment. 4. Which communication strategy is most effective when providing corrective feedback to an adult CNA learner? A. Deliver feedback publicly to motivate others. B. Use technical jargon to appear authoritative. C. Focus on what the learner did wrong in isolation. D. Use the sandwich method, positive, constructive, positive. 5. An oncology CNA instructor is reviewing curriculum content. To ensure compliance with regulatory standards, the instructor should: A. Update modules based on new research articles. B. Include feedback from learners only. C. Align content with state and federal CNA training regulations. D. Create content based solely on personal clinical experience. 6. Which mentoring activity would best support a new oncology CNA in developing clinical competence? A. Allowing full independence without supervision. B. Assigning written assignments on cancer theory. C. Providing side-by-side clinical support with structured feedback. D. Limiting responsibilities to avoid mistakes. 7. An adult learner in the CNA oncology course expresses frustration over a concept. How should the instructor respond? A. Tell the learner to read the textbook again. B. Provide a lecture on the topic without interaction. C. Facilitate a guided discussion to explore the concept. D. Refer the learner to a peer. 8. A CNA instructor is documenting a student's progress. What is the most appropriate method for clinical record keeping? A. Subjective impressions written informally. B. Verbal reports to the supervisor only. C. Structured evaluations with dated entries in secure records. D. Email summaries stored in a personal inbox. 9. A student fails to don appropriate PP in an oncology unit. What legal or ethical obligation must the CNA instructor fulfill? A. Ignore it since it was unintentional. B. Wait to address it during the next review. C. Intervene and document the incident for program accountability. D. Discuss it privately without documenting. 10. When developing an oncology CNA curriculum, which component ensures alignment with best practices in adult education? A. Focus on theoretical knowledge only. B. Frequent testing without hands-on practice. C. Clear learning objectives tied to measurable outcomes. D. Use of videos as the only teaching method. 11. A CNA instructor observes a student struggling with time management during clinical rotations. Which teaching strategy is most supportive? A. Remove the student from clinicals. B. Assign the student to less demanding patients. C. Provide time-blocking strategies and check-ins. D. Ignore the issue unless a supervisor complains. 12. Which feedback method best supports adult learners in developing new clinical skills? A. Delayed written critiques. B. Immediate, constructive, behavior-specific feedback. C. General praise without examples. D. Peer grading without instructor review. 13. A CNA instructor is updating a module on cancer pain management. What should guide the revision process? A. Institutional tradition. B. Anecdotal patient experiences. C. Current clinical guidelines and evidence-based practices. D. Previous course evaluations alone. 14. In the context of adult learning, what is the most effective motivator for oncology CNA students? A. Fear of failure. B. Rigid grading policies. C. Relevance of content to their clinical responsibilities. D. Instructor authority. 15. The primary goal of formative evaluation during CNA instruction is to A. Assign final grades. B. Identify areas for immediate improvement. C. Compare students to each other. D. Delay feedback until the end of the course. 16. An oncology CNA instructor must legally retain training records for how long in most jurisdictions? A. 6 months. B. 1 year. C. 3 to 5 years depending on state regulations. D. Indefinitely. 17. Which mentoring strategy best promotes critical thinking in oncology CNAs? A. Providing all answers to minimize confusion. B. Allowing unstructured clinical practice. C. Asking open-ended questions during supervision. D. Repeating skills until memorized. 18. An oncology CNA student asks for extra help understanding neutropenic precautions. The instructor should A. Tell the student to consult a nurse. B. Recommend online resources only. C. Provide an individualized teaching session with demonstration. D. Advise the student to wait for the next lecture. 19. Which evaluation tool is most effective for assessing clinical decision-making in a CNA oncology student? A. Multiple choice tests. B. Daily attendance logs. C. Case-based simulations with debriefing. D. Peer reflection journals. 20. A student exhibits poor bedside communication with a terminally ill cancer patient. What should the CNA instructor prioritize? A. Removing the student from future patient contact. B. Providing a written warning. C. Role-playing empathetic communication and coaching. D. Reporting the student to licensing boards. 21. When designing lesson plans for adult CNA learners in oncology, the instructor should A. Prioritize memorization of terminology. B. Incorporate interactive and scenario-based exercises. C. Use identical content from pediatric care modules. D. Rely solely on textbook reading assignments. 22. A student CNA in oncology care consistently arrives late to clinical rotations. What is the best initial instructor response? A. Dismiss the student from the program. B. Notify the certifying board immediately. C. Conduct a private discussion to understand barriers and review expectations. D. Ignore the issue unless a patient complains. 23. What method of instructional delivery is most effective for adult learners in oncology CNA programs? A. Passive video lectures without interaction. B. Teacher-centered lectures with minimal student participation. C. Problem-based learning with case studies. D. Memorization drills. 24. Which of the following best defines the purpose of a train-the-trainer CNA oncology course? A. To teach students how to care for terminal patients. B. To provide basic nursing assistant instruction. C. To prepare experienced CNAs to educate and mentor others. D. To recertify oncology nurses. 25. In adult learning theory, self-directed learning means A. Students learn without any structure. B. Learners independently determine their learning needs and take initiative. C. Instructors dictate all course material and schedule. D. Only online modules are used. 26. An effective clinical instructor must demonstrate which primary characteristic during student evaluations? A. Authority and rigidity. B. Subjective decision-making. C. Consistency and objectivity. D. Emotional distance. 27. A CNA instructor designs a learning activity in which students rotate through simulated oncology care scenarios. This is an example of A. Passive instruction. B. Reflective journaling. C. Experiential learning. D. Rote memorization. 28. A student asks questions that challenge the standard oncology protocol. What should the instructor do? A. Discourage the questioning to maintain order. B. Encourage critical thinking and discuss evidence-based standards. C. Refer the student to a physician. D. Punish the student for insubordination. 29. Which best supports long-term knowledge retention for adult CNA oncology students? A. Long lectures without breaks. B. Cramming before exams. C. Regular review sessions with active recall and feedback. D. Last-minute reading of textbooks. 30. During a clinical skill check-off, the instructor notices inconsistent hand hygiene. What is the most appropriate immediate action? A. Terminate the clinical rotation. B. Stop the skill, provide immediate correction, and document the observation. C. Wait until the end to mention it. D. Report the student to the state board. 31. When preparing oncology CNA students for communication with dying patients, instructors should emphasize A. Avoiding patient interaction. B. Strict professionalism only. C. Active listening and presence. D. Distraction and humor. 32. Which is a primary ethical duty of a CNA instructor during clinical rotations? A. Delegating evaluations to floor staff. B. Ignoring minor protocol violations. C. Ensuring patient and student safety at all times. D. Avoiding feedback to maintain neutrality. 33. In oncology CNA training, the most effective method for teaching safe handling of cytotoxic medications is A. A written test only. B. Peer-to-peer instruction. C. Instructor-led demonstration followed by student return demonstration. D. Posting protocols on the wall. 34. An oncology CNA student makes a documentation error. What is the instructor's best course of action? A. Instruct the student to rewrite the record. B. Review the correct procedure and have the student complete an error report under supervision. C. Ignore the issue. D. Correct it for the student without documentation. 35. Which best describes competency-based evaluation in CNA oncology training? A. Comparing all students to each other. B. Using only written exams to measure skill. C. Assessing whether a student meets specific performance criteria. D. Giving credit for attendance. 36. A student CNA expresses emotional distress after witnessing a patient death. What should the instructor do? A. Dismiss the student from clinicals. B. Encourage reflection and refer to counseling resources if needed. C. Advise them to avoid end-of-life care. D. Ignore the concern. 37. A clinical instructor reviews a student's behavior in a patient care situation. What feedback method enhances learning? A. General praise with no specifics. B. Public critique during rounds. C. Private, focused feedback based on observable behaviors. D. Delayed evaluation a week later. 38. Which instructional strategy aligns best with adult learning preferences? A. Authoritative lectures. B. Hands-on problem-solving related to work experiences. C. Memorization tests only. D. Assigned textbook chapters without discussion. 39. A CNA oncology instructor reviews a student's competency evaluation form. What is the most important aspect to verify? A. The neatness of handwriting. B. That all objectives are marked with specific performance ratings. C. The student's opinion of their performance. D. The order of completed tasks. 40. What is the main purpose of curriculum mapping in oncology CNA education? A. To track student behavior. B. To align instruction with performance objectives and regulatory standards. C. To avoid instructor evaluations. D. To collect data for marketing. 41. Which of the following best ensures curriculum content remains compliant with oncology CNA certification standards? A. Including instructor preferences. B. Reviewing course evaluations only. C. Regularly aligning with state and federal guidelines. D. Using previous student materials. 42. A CNA oncology instructor uses reflective journaling in the program. What is the primary benefit of this strategy? A. To track attendance. B. To improve memorization. C. To encourage self-assessment and critical thinking. D. To replace clinical hours. 43. When mentoring new CNA instructors, which approach promotes professional growth? A. Assigning all responsibilities without guidance. B. Shadowing with feedback sessions. C. Requiring solo teaching from day one. D. Avoiding performance evaluations. 44. A student in an oncology CNA course is underperforming in foresight care. What should the instructor do? A. Remove the student from clinicals immediately. B. Allow more practice opportunities with instructor oversight. C. Wait to address it during final evaluations. D. Ignore unless a nurse reports it. 45. What is the instructor's responsibility regarding patient rights in a CNA oncology clinical setting? A. Only inform the student of them. B. Protect patient dignity and confidentiality while teaching. C. Leave decisions to the hospital supervisor. D. Allow unrestricted student access. 46. An adult CNA learner is distracted during lectures. What instructional method would better engage them? A. Increase the lecture duration. B. Use case studies and problem-solving scenarios. C. Add more theoretical content. D. Ignore the behavior. 47. During evaluations, why should an oncology CNA instructor use standardized checklists? A. To reduce grading time. B. To improve legal defensibility and objectivity. C. To replace direct observation. D. To allow for easier student self-assessment. 48. What is the most appropriate method for assessing a CNA student's ability to provide palliative care? A. A multiple-choice quiz. B. A group discussion. C. A direct observation during simulated patient care. D. An attendance report. 49. A CNA instructor must terminate a student from the oncology program. What documentation is necessary? A. Verbal notice only. B. Informal notes. C. Detailed written records of incidents and actions taken. D. Peer evaluations. 50. In adult learning theory, instructors should A. Treat learners as passive recipients. B. Assume learners have no experience. C. Recognize and build on learners' prior knowledge. D. Discourage student input. 51. What is the best way to foster communication between oncology CNA students and instructors? A. Assign weekly silent reading. B. Use open forums for clinical debriefings. C. Restrict interaction to written feedback. D. Avoid emotional discussions. 52. During curriculum planning, what must be considered to meet the diverse needs of adult learners? A. Gender-based seating. B. A variety of instructional strategies and flexible pacing. C. Standardized one-size-fits-all content. D. Removing collaborative activities. 53. An oncology CNA student questions the necessity of a particular infection control protocol. The instructor should A. Ignore the question. B. Explain the evidence and rationale behind the protocol. C. Refer the student to the facility manager. D. Tell them it's not open for discussion. 54. Which of the following is an example of summative assessment in CNA oncology training? A. Daily reflective logs. B. Mid-clinical check-ins. C. Final skills examination. D. Classroom participation. 55. What communication strategy helps de-escalate student frustration during clinical training? A. Using dismissive language. B. Speaking with empathy and clarity. C. Ignoring complaints. D. Raising one's voice. 56. An oncology CNA instructor creates a case study that requires students to prioritize care for multiple patients. This best promotes A. Group memorization. B. Critical thinking and clinical judgment. C. Note-taking skills. D. Time-based testing. 57. A CNA student shares confidential patient information during a class presentation. The instructor must A. Ignore the breach. B. Publicly scold the student. C. Review HIPAA guidelines and document the incident. D. Only warn the class generally. 58. Which element is essential in clinical instruction of cancer pain management? A. Memorizing medication names. B. Assessing and adjusting care based on patient feedback. C. Avoiding touch with patients in pain. D. Letting the nurse handle pain control. 59. In a train-the-trainer course, which is most important for new instructors to learn? A. Teaching only from slides. B. How to discipline students. C. Techniques for adult education and learner engagement. D. Time card reporting. 60. What defines an effective mentoring relationship in clinical instruction? A. Instructor dominance. B. Structured support with clear communication and feedback. C. Avoiding emotional investment. D. Allowing only written communication. 61. A CNA instructor includes pre- and post-assessments in an oncology module. This is an example of A. Ethical oversight. B. Regulatory compliance. C. Measuring learning outcomes. D. Administrative record keeping. 62. Instructors are required to maintain documentation for clinical CNA training to A. Meet audit and accreditation standards. B. Satisfy students. C. Avoid teaching. D. Replace evaluations. 63. A student improperly disposes of a cytotoxic waste bag. The instructor should A. Wait for the student to realize the error. B. Immediately correct the action and document it. C. Dismiss the student from training. D. Ignore unless harm occurs. 64. What is a legal responsibility of an oncology CNA clinical instructor? A. Licensing students. B. Reporting unsafe practice. C. Administering medication. D. Hiring faculty. 65. CNA oncology students request more interactive learning. The instructor should A. Increase reading assignments. B. Add collaborative case-based learning. C. Eliminate group work. D. Focus more on quizzes. 66. Which of the following is the best example of feedback that promotes clinical growth? A. You always make mistakes. B. That wasn't right. C. You missed PP protocol, let's review it together. D. Don't do that again. 67. A CNA oncology instructor wants to update clinical procedures in the curriculum. What source is most appropriate? A. Personal preference. B. National Cancer Care Guidelines. C. Older textbooks. D. Internet forums. 68. The key benefit of peer mentoring among CNA oncology students is A. Less work for instructors. B. Competitive grading. C. Reinforcement of skills through collaborative learning. D. Limiting instructor time. 69. The instructor's clinical performance evaluations must be A. Vague and flexible. B. Consistent, measurable, and based on performance criteria. C. Based on classroom participation only. D. Randomized each term. 70. During a simulation of terminal care, a CNA student becomes emotional. What should the instructor do? A. Criticize the student for being unprofessional. B. End the simulation early. C. Debrief and support emotional processing. D. Ignore and move on. 71. Which of the following is the most effective way for a CNA instructor to address cultural diversity in oncology training? A. Ignore cultural differences to treat everyone equally. B. Incorporate culturally sensitive communication and care practices. C. Use only English language materials. D. Avoid discussing cultural beliefs related to cancer care. 72. A student CNA shows reluctance to assist with a patient's end-of-life care due to personal beliefs. The instructor should A. Force the student to participate regardless of feelings. B. Explore the student's concerns and provide supportive guidance. C. Remove the student from the program immediately. D. Ignore the student's feelings. 73. Which principle of adult learning is demonstrated when the instructor encourages students to share their clinical experiences during class discussions? A. Learning is passive. B. Prior knowledge enhances learning. C. Adults resist learning new material. D. Repetition is unnecessary. 74. What is the primary purpose of conducting a clinical skills check-off in oncology CNA training? A. To document attendance. B. To verify student competency in specific skills. C. To provide general feedback at the end of the course. D. To replace written exams. 75. An oncology CNA instructor notices a student exhibiting signs of burnout. What is the best instructor response? A. Encourage the student to discuss feelings and offer resources for support. B. Ignore it unless performance declines. C. Give the student more assignments to build resilience. D. Advise the student to quit. 76. Which of the following best represents a formative evaluation method in CNA oncology education? A. Final clinical competency exam. B. Ongoing skill observation with immediate feedback. C. End of program survey. D. State certification test. 77. During clinical supervision, how can an instructor best ensure patient safety? A. Allow students to work independently at all times. B. Closely observe student actions and intervene when necessary. C. Focus only on student confidence. D. Delegate supervision to nursing staff. 78. Which documentation practice is critical for CNA clinical instructors? A. Keeping informal notes only. B. Detailed and timely recording of student progress and incidents. C. Documenting only when problems arise. D. Avoiding documentation to protect student privacy. 79. An oncology CNA instructor wants to improve students' critical thinking. Which teaching method is most effective? A. Rote memorization of procedures. B. Presenting real patient case scenarios for discussion. C. Reading aloud from textbooks. D. Focusing on lecture-based delivery. 80. When giving feedback to a student who made a clinical error, the instructor should A. Focus on the behavior, not the student's character. B. Avoid mentioning the error to protect confidence. C. Use harsh language to discourage mistakes. D. Provide feedback only at the end of the course. 81. The primary legal concern for CNA instructors in clinical settings is A. Maintaining student attendance. B. Preventing patient harm through proper supervision. C. Managing course registration. D. Grading exams fairly. 82. An instructor uses a learning contract to tailor oncology CNA training for a student struggling with time management. This approach aligns with which adult learning principle? A. Learning is passive. B. Learners are self-directed and responsible for their progress. C. Instructor-centered teaching is best. D. One curriculum fits all. 83. What is the best way to document a student's clinical skill deficiencies? A. Informal verbal warnings only. B. Written performance evaluations with specific examples and remediation plans. C. Ignoring minor mistakes. D. Peer reviews without instructor input. 84. An oncology CNA student reports witnessing a breach in patient confidentiality. The instructor should A. Dismiss the report as hearsay. B. Investigate according to institutional policy and provide guidance. C. Keep the information confidential without action. D. Tell the student to mind their own business. 85. Which method is most effective for teaching communication skills with oncology patients? A. Role-playing and simulated patient interactions. B. Lectures on communication theory only. C. Assigning reading on medical terminology. D. Watching videos without practice. 86. A student asks the instructor for advice on coping with the emotional stress of oncology work. The instructor should A. Refer the student to counseling and offer support. B. Tell the student to toughen up. C. Ignore the request. D. Suggest quitting the program. 87. What is the best way to assess an oncology CNA student's understanding of regulatory compliance? A. Observe clinical practice and review documentation accuracy. B. Ask the student to memorize rules verbatim. C. Give an open book test only. D. Assume compliance based on attendance. 88. During clinical supervision, a student fails to follow infection control protocols. The instructor should A. Document the violation and immediately correct the student. B. Wait until the clinical rotation ends to discuss. C. Ignore unless an infection results. D. Allow peer correction only. 89. Which of the following best supports learner motivation in adult oncology CNA education? A. Emphasizing the relevance of content to real-world clinical practice. B. Using only traditional exams. C. Minimizing student involvement. D. Providing only negative feedback. 90. A CNA instructor wants to evaluate the effectiveness of a new oncology care curriculum. The best approach is to A. Survey only the instructors. B. Collect feedback from students, clinical staff, and analyze student outcomes. C. Rely on anecdotal evidence. D. Avoid evaluation to save time. 91. The documentation of clinical incidents involving students must be A. Kept confidential and used for remediation. B. Shared publicly for transparency. C. Ignored unless legally required. D. Destroyed after the course ends. 92. An oncology CNA student demonstrates difficulty with verbal communication in clinical settings. The instructor should A. Provide targeted communication skills training and practice opportunities. B. Allow the student to avoid verbal tasks. C. Lower performance expectations. D. Recommend withdrawal from the program. 93. When mentoring a new CNA instructor, the most effective technique is to A. Assign them to lecture immediately without support. B. Provide observation, feedback, and gradual responsibility. C. Limit their contact with students. D. Avoid mentoring to promote independence. 94. Instructors must ensure clinical assignments comply with which of the following? A. The student's personal preferences. B. Facility policies, state regulations, and scope of practice. C. Instructor convenience only. D. Peer recommendations. 95. Which of the following is an example of unethical behavior for a CNA clinical instructor? A. Providing honest, constructive feedback. B. Showing favoritism towards certain students. C. Maintaining confidentiality. D. Encouraging professionalism. 96. To support students' emotional well-being, oncology CNA instructors should A. Offer opportunities for debriefing and peer support after difficult clinical experiences. B. Ignore emotional topics. C. Discourage emotional expression. D. Refer all issues to social work without discussion. 97. What is a primary reason for using simulation in oncology CNA education? A. To replace clinical rotations. B. To provide a safe environment for practicing skills and decision-making. C. To reduce instructor workload. D. To increase lecture time. 98. A student makes a serious error during clinical care. The instructor should A. Immediately intervene, provide corrective instruction, and document the event. B. Wait until clinical ends to discuss. C. Report the student to the state board without discussion. D. Ignore it if no harm occurred. 99. How can oncology CNA instructors best stay current with clinical practice updates? A. Attending professional development and reviewing current guidelines. B. Relying on past training only. C. Using outdated textbooks. D. Avoiding continuing education. 100. What is the main goal of clinical debriefing sessions? A. To punish students. B. To reflect on experiences, reinforce learning, and address concerns. C. To reduce clinical hours. D. To collect attendance. 101. when planning clinical assignments, the instructor must consider A. Student learning objectives and patient safety. B. The easiest tasks for students. C. Reducing supervision time. D. Student friendships. 102. Which is the most effective way to document student progress in clinical oncology CNA training? A. Daily detailed notes linked to competency checklists. B. End-of-term general comments. C. Verbal feedback only. D. Informal peer reports. 103. A student challenges an instructor's clinical decision. The instructor should A. Dismiss the challenge immediately. B. Encourage respectful discussion and provide evidence-based explanations. C. Report the student for insubordination. D. Avoid further interaction. 104. An effective oncology CNA curriculum includes A. Only theoretical knowledge. B. Skills training, communication, ethics, and regulatory content. C. Irrelevant content for engagement. D. No clinical practice. 105. When providing feedback, the instructor should A. Use specific examples and suggest improvement strategies. B. Generalize errors. C. Focus on personal attributes. D. Avoid feedback to protect confidence. 106. Which is a critical component of adult learning theory for oncology CNA education? A. Adults learn best through punishment. B. Adults bring life experiences that influence learning. C. Adults prefer only lectures. D. Adults dislike self-reflection. 107. What is the best way to maintain student confidentiality during clinical training documentation? A. Use student ID numbers instead of names. B. Share records freely with peers. C. Post evaluations publicly. D. Keep paper files unlocked. 108. A CNA student expresses doubt about the effectiveness of a pain management plan. The instructor should A. Ignore the comment. B. Discuss pain management principles and encourage open communication with the healthcare team. C. Tell the student to comply without question. D. Avoid patient discussions. 109. Which documentation is required after a clinical incident involving a student? A. A detailed incident report including student and patient information, actions taken, and outcomes. B. An informal note. C. No documentation unless injury occurs. D. Only verbal notification. 110. An oncology CNA instructor integrates multimedia tools in teaching. This approach A. Distracts students. B. Enhances engagement and caters to varied learning styles. C. Is discouraged by regulatory bodies. D. Should replace hands-on practice. 111. Which of the following best reflects ethical communication in clinical education? A. Using jargon to maintain authority. B. Providing clear, respectful, and honest information. C. Avoiding difficult conversations. D. Sharing confidential student information. 112. A student struggles with time management during clinical rotations. The instructor can best assist by A. Assigning fewer clinical hours without explanation. B. Helping the student develop a schedule and prioritize tasks. C. Ignoring the issue. D. Penalizing the student for poor time use. 113. What is a common barrier to effective clinical instruction for oncology CNA students? A. Lack of clinical space. B. Over-involvement of instructors. C. Insufficient student motivation and engagement. D. Excessive simulation. 114. When should an instructor report unsafe student behavior during clinical training? A. Only after patient harm occurs. B. Immediately upon observation of the behavior. C. At the end of the program. D. If other students complain. 115. Which is the most accurate statement about regulatory compliance in oncology CNA programs? A. It is optional for clinical instructors. B. It involves adhering to state laws, facility policies, and certification requirements. C. Only students are responsible. D. It is not monitored. 116. An oncology CNA instructor wants to promote lifelong learning. Which activity supports this goal? A. Encouraging professional networking and continuing education. B. Focusing solely on initial certification. C. Discouraging additional coursework. D. Limiting learning to clinical hours. 117. A student consistently fails to follow safety protocols. What is the instructor's first step? A. Document the issue and provide focused remediation. B. Dismiss the student immediately. C. Ignore the behavior. D. Allow peers to manage. 118. In oncology CNA training, documentation of clinical skills should be A. Subjective and generalized. B. Objective, measurable, and timely. C. Based on student self-report only. D. Deferred until program completion. 119. Which communication method best supports students with varying learning needs? A. Sole reliance on lectures. B. Multimodal instruction including visual, auditory, and kinesthetic approaches. C. Only written materials. D. Avoiding technology. 120. An instructor uses role play to teach CNA students how to communicate bad news. This strategy is an example of A. Passive learning. B. Experiential learning. C. Memorization. D. Lecturing. 121. When planning a clinical learning experience, the instructor should prioritize A. Student interests over learning objectives. B. Patient safety and achievement of competency goals. C. Reducing instructor workload. D. Scheduling convenience. 122. Which strategy best helps oncology CNA students retain complex information? A. Repeated passive listening to lectures. B. Active learning with case studies and hands-on practice. C. Reading without discussion. D. Skipping practice to save time. 123. A student CNA reports feeling overwhelmed by the volume of material. The instructor should A. Suggest time management and study skills coaching. B. Advise the student to drop the course. C. Ignore the concern. D. Reduce clinical hours without explanation. 124. Which evaluation tool provides the most objective assessment of clinical skills? A. Instructor's subjective opinion. B. Standardized skills checklist. C. Student self-assessment only. D. Peer feedback without validation. 125. During a clinical rotation, a student violates patient confidentiality. The instructor should A. Address the breach immediately and follow institutional policy. B. Ignore the breach if no harm occurred. C. Discuss only with the student privately without documentation. D. Punish the student publicly. 126. What is an essential feature of effective clinical mentoring? A. One-way communication from mentor to mentee. B. Mutual respect, trust, and open communication. C. Avoiding challenging discussions. D. Providing only positive feedback. 127. When designing a curriculum for oncology CNA training, the instructor should A. Base content solely on textbook chapters. B. Incorporate evidence-based practices and regulatory standards. C. Focus only on theoretical content. D. Exclude clinical application. 128. How can CNA instructors ensure compliance with HIPAA during clinical teaching? A. Discuss patient information openly in group settings. B. Teach and model strict confidentiality and privacy practices. C. Allow students to access all patient records freely. D. Ignore privacy policies for convenience. 129. An oncology CNA student is consistently late for clinical shifts. The instructor should A. Document the behavior and discuss punctuality expectations with the student. B. Ignore lateness unless it affects patient care. C. Reduce clinical hours as a penalty. D. Publicly reprimand the student. 130. Which communication technique is most effective when providing constructive criticism? A. Using I statements and focusing on specific behaviors. B. Generalizing the problem to all students. C. Avoiding feedback to prevent conflict. D. Using sarcasm to lighten the mood. Oncology CNA Certified Nursing Assistant. The Oncology CNA Certified Nursing Assistant test is a specialized assessment designed for CNAs who have completed advanced training in cancer care through internal hospital programs or accredited certification courses. This exam evaluates a candidate's competency in providing safe, compassionate, and effective care to oncology patients across various clinical settings. It covers essential topics such as cancer pathology, chemotherapy precautions, palliative care, infection control, patient communication, ethical responsibilities, and psychosocial support. The test also emphasizes adult learning principles, clinical instruction skills, documentation practices, and mentoring abilities, ensuring CNAs are fully prepared to meet the complex needs of oncology patients under the supervision of licensed healthcare professionals. Here are the top 5 beneficial uses of the sample exam. 1. Enhanced patient care quality. Oncology CNA certification ensures CNAs possess the specialized skills needed to support cancer patients through treatments such as chemotherapy, radiation, and palliative care, improving safety and outcomes. 2. Professional advancement. This certification boosts a CNA's credentials, enabling access to higher-paying roles, greater responsibilities, and advancement within oncology or hospice departments. 3. Standardized competency validation. Hospitals and care facilities use the test to validate a CNA's ability to meet internal cancer care protocols and regulatory standards, promoting consistency in care delivery. 4. Improved team integration. Certified CNAs are better prepared to collaborate with oncology teams, understand treatment plans, and communicate effectively with patients and families. 5. Regulatory and accreditation compliance. Hospitals utilize the test to ensure staff meet training requirements for oncology care, supporting institutional accreditation and quality assurance initiatives.